Here we have a Broda Chair 30 VT. Broda chairs are intended exclusively for residents of long-term care institutions who are under the care of professional caregivers. The basic 30 VT Broda chair are positioning chairs intended for medium to high-level care patients or residents. The weight capacity of the Broda Chair 30 VT is 660 pounds at the casters. There are different size Broda chairs available, starting from 18 inches wide seat width in 2-inch increments up to 28-inch wide seat width. So that will be 18, 20, 22, 24, 26, and 28-inch sizes for Broda chairs. When it comes to your bariatric residents, they do have extra gas cylinder beds installed to withstand the greater weight capacity of your bariatric resident. Broda 30 VT chairs are not to be used in the shower, as use in the shower may cause the frame or components to rust. When using a Broda chair for a patient, you always want to be able to notice the position of the chair for safety precautions. Immediately after a resident is transferred into a Broda chair, we recommend that the chair seat be tilted sufficiently to prevent the resident from sliding or falling forward off the chair. In order to position the seat tilt on the back side of your Broda chair, you will have a lever that will actuate the hydraulic gas cylinder in order to manipulate your seat angle. Here's your seat tilt handle. In order to operate the seat tilt, you would want to squeeze the handle here. While holding the handle squeezed, you may push down on the frame in order to change the angle of your seat. Doing that when a patient is transferred into the chair will help prevent the patient from sliding forward or falling off the chair. It is recommended to operate the seat tilt sufficiently in order to prevent an agitated resident from tipping the chair forward or backward, as well as from slumping and sliding in the chair. Be aware of the location of the chair as you place your residents in the chair. We recommend that when a resident has been moved to their place of destination, that the Broda Chair 30 VT is placed where the resident cannot reach handrails or other fixed objects that are movable. Doing this will help prevent the resident from pulling the chair over or pulling themselves off the seating surface, and to prevent the resident from pulling any movable objects onto the chair or onto their body themselves. When positioning the chair in a specific location for the patient, you will find that there are 3 total lock casters on your wheels and 1 directional caster, which is noticeable by a slightly different color code, which is darker gray in the color. To activate the locks or unlock the locks of your Broda chair, simply press down on the lock. Whenever positioning any patient into the chair or transferring a patient out of the chair, it is recommended that all wheels will have been locked and secured. It is recommended to lock the total locks when the chair is not in use, to prevent the chair from moving if in a sloped area. It is also recommended to lock the locks, as we said, when a resident or patient is being transferred or moved into or out of the Broda Chair 30 VT. It is important to note that if the wheel locks are applied while the patient is in the chair, that the caregiver does not leave the patient unattended, especially those patients who have the capability or tendency to move the chair and or those who may be agitated. If you do have a resident who is agitated or is capable of moving the chair, if he were to attempt to do so, it may cause harm to the patient or damage the wheel locks themselves while in the locked position. Whenever repositioning the patient in your Broda Chair 30 VT, it is always recommended to check the resident's arms, and they must make sure the arms are positioned within the inside of the chair frame. This would be in between the armrest. The resident's feet should be correctly placed on your footrest. Here. Your footrest is adjustable in length. The lengths that the footrest may be adjusted to are 16 inches, 18 inches, 20 inches, and 22 inches in length. When positioning a footrest or elevating leg rest for any patient on any seating arrangement, the best fit or placement of the patient's feet onto the footrest or elevating leg rest, when placed, you should be able to fit one hand width between the patient's under thigh and the surface area of the actual seat. If the current angle is not suitable for the patient or resident that has been placed into your Broda chair, in order to make your adjustments on your actual footrest, you will first need to make sure the resident is out of the chair in order to operate the spring and footrest safely. On your footrest, it is spring loaded. You will need to hold to the side of your footrest while holding onto the frame. Press the spring to the right and then pull forward and then remove the actual footrest. If you see here, this bar is a spring-loaded set bar. So in order to remove and place, this is the side that will be placed and pressed first. On your Broda chair leg rest, you will have different hole segments for your 16, 18, 20, and 22 inch length sets. If adjusting your leg rest for longer lengths, simply remove the footrest, select the next appropriate set for your leg rest adjustment, place your spring bar into position first. When it is mounted in position, compress your spring, slide the opposite end of the bar into the opposite hole, release your spring, and set the footrest into place. It is also important when positioning your patient in your Broda chair to make sure that all wheels have been totally locked as previously noted. We will turn this around briefly. Make sure all wheels have been totally locked, as well as only move one function at a time. Whether it is the seat tilt to adjust the angle of your seat, or your recline to adjust the angle of the back. The 30 VT is capable of up to 45 degrees of recline from the upright position. In order to recline the patient, while seated in your Broda chair, simply squeeze the lever which controls your gas cylinder, hold on to your frame, and then slowly recline the patient. Whenever any type of recline or repositioning is done for your patient, it is always recommended to tilt the seat first, so as you recline, it will help to prevent the patient from sliding or slumping forward. It is recommended to reposition the patient every 30 to 45 minutes as to relieve pressure of the patient as they rest in their Broda chair. The Broda Chair 30 VT does also have a lever mechanism similar to your recline and your tilt lever, which will allow for manual adjustment of the elevation of your leg rest. The lever to manually adjust your elevation of your leg rest is located on the side of your Broda chair. We will first unlock the wheel so we return the Broda chair to the side. This lever here is the lever that is used to manually adjust the elevation of your leg rest. The elevation of the leg rest is actuated with the movement of the recline function. So as you recline, your leg rest may change position. If the position is uncomfortable for the patient when reclined in the reclined position, to manually adjust for patient comfort, simply squeeze the lever while holding the lever, then manually adjust the elevation of your footrest. Squeeze that there. Then you may manually change the position. When the position is set, simply release the lever to lock into position. If your Broda Chair 30 VT does get soiled, it is best to clean with a mild soap and water solution. Simply spray down your Broda Chair with your mild soap and water solution, wipe it with a damp cloth, and then dry it with a dry cloth. The wings of your Broda Chair, which are added for patient comfort, located here on the sides or shoulder area of the patient's Broda Chair, are also easily removable for patient comfort. In order to remove your wings, either left side or right side, there will be two stopper button placement sets located on the actual frame of the Broda Chair wing. In order to remove that, simply first squeeze and depress the stopper button located at the top of the Broda Chair here, and remove the top side first. When you have removed the top side, simply press the lower stopper button while depressed, and then slide the bottom side of the wing out. So your wings are adjustable and removable. The cushions on your wings are also adjustable in placement, as there are adjustable straps located on the rear of the pad. To release and to adjust, there is quick release locks. Simply press to disconnect the male and female ends. Adjust the strap, slide down to the correct position, and then reconnect your female and male fittings until they snap and lock into place. When placing your Broda chair wing back onto your Broda chair, it is recommended to set the bottom first. Simply position it into the bracket, depress the stopper button, and slide that through until it locks. Next, position the top bar into place. Press and keep the button depressed, and push the wing into place set until your stopper button stops into the proper hole set. The same method to remove the left wing will be the same method that you may be able to use and adjust on your right wing. The head pillow centered in between the two wings is also adjustable with a strap and removable. It does have the same male and female fitting quick disconnect snap locks as the cushions, which are located and secured onto the wings of the Broda chair. So this is the head pillow, which is also adjustable for patient height. The strap is adjustable with your female and male snap locks. Once you choose your correct height level for the patient, simply slide into position behind the patient's head. When your pillow is adjusted in the correct position, simply wrap one strap around the right side, wrap the opposite strap around the left side of the chair, and then snap your female and male quick locks until they snap into position and lock into position. And that would be how you would adjust your head pillow as well. The seat tilt range has a 25-degree angle range from parallel to 25 degrees. So that would be parallel, or the most upright position of the seat tilt. And then it has a range of tilt all the way up to a complete 25 degrees of tilt. The tilt should be set and adjusted to the professional healthcare giver that is responsible for the patient. You do have an adjustable height for the armrest of your Broda Chair 30 VT. The adjustable height is approximately a 6-inch range. In order to adjust the height of the armrest of your Broda chair, you will need a 5/32 inch Allen wrench to loosen the lock nut set screws located underneath the side panel on the side of your armrest. To access your lock set screws, simply unvelcro the side panel to gain access to your lock set screws. Using your 5/32 inch Allen key, simply loosen the lock set screw by turning counterclockwise. When loose, raise and adjust your armrest to the proper adjustment setting with a range of 6 inches. When you have the appropriate set adjustment height, simply turn your lock set screws to the right to lock the position and height of your armrest. After you change the left side height, you will also use the same method to change the right side height adjustment of your armrest. Any adjustments to the armrest should be made when the patient is not in the chair, as to prevent any injury or harm to the patient. as well as having an adjustable armrest height, you do have an adjustable seat height. The Broda Chair 30VT seat heights are 19.5 inches, 20.5 inches, and 21.5 inches. In order to make any type of seat height adjustments, of course, the patient or resident should not be occupying the chair as to prevent any harm or safety to come to the resident. Then you will need a 7 16 inch wrenches to remove the bolts in order to change the height set of your seat. The height set adjustment bracket and bolts are located towards the front of your frame here. These hole settings will change the height of your seat to the heights previously mentioned. When changing the height seat adjustment, you'll want to make sure that both left and right sides are properly set into the same hole location or height adjustment location. To help assist with moving and transferring of the patient from one location to another, we said there is a directional lock. This lock caster is easily noticeable by the darker color of the actual lock caster. The lock directional caster is usually located on the rear of the chair, here. When engaging the directional lock caster, simply lock that down in position. The directional lock caster, which is noticeable by the darker color gray located on the rear of your chair, is to help assist with maneuvering the patient through a straightaway or through a hallway down the aisle. So when engaged in this position, it will lock in one direction as to help maneuver the patient in a straight line. All other wheels should be unlocked at this time when maneuvering or transferring a patient from one location to another location or down the aisle or hallway. The Broda Chair 30VT is one of the only chairs that does have a mapping study and a pressure study for pressure relief patients. The foam is made of a memory foam already pressure reducing for those patients. It is recommended to not have to use a gel cushion or star cushion in a Broda chair seating because the memory foam that is made of the padding is already pressure relieving. The straps will also help heat to the body's temperature in order to cup and shape to the body's form as to help to relieve pressure as the resident is rest in the Broda chair for longer periods of time. Most important, once again, whenever making any type of positioning of the patient in your Broda chair when occupied, always make sure the resident's arms are within the frame of the Broda chair and out of the way of any moving parts. Make sure the feet are properly placed on your footrest. Always ensure that your wheels are totally locked. Tilt the seat first as to prevent the patient from sliding or slumping or leaning forward when reclining. Your Broda Chairs 30VT or any style of your Broda chairs, whether it's a 785 Elite Broda chair or a Broda pedal chair, you do have a Broda tray as an optional accessory for those patients who would like to eat or have a meal while sitting in their Broda chair. They are different widths for your actual Broda chair needs. So you do have 18-inch, 20-inch, 22-inch, and 24-inch Broda chair trays available to order for your Broda chairs. In order to place a Broda chair tray onto your Broda chair, you do have guides located on the bottom side which will slide around the armrest of your Broda chair. Here and here. You do have your female and male quick connect and disconnect snap lock connectors with your adjustable strap. Release the quick connect disconnect snap lock connector. Place your Broda chair tray into position onto the chair armrest. Simply slide your Broda tray back until the correct position is obtained for your Broda chair tray for your patient. Then wrap one side around the right side of your chair, the opposite side around the left side of your chair. Snap your quick snap lock connectors together to lock the tray onto the chair. And once again, your Broda chair tray is an optional accessory that does come in 18 inches, 20 inches, 22 inches, and 24 inches. If the surface of your tray did get dirty or soiled, simply clean it with the same mild and soap and water solution that you used to clean the surface area of the Broda. Spray it down, wipe it with a damp cloth, and dry it with a dry cloth. This here is a Broda 785 Elite Transfer Chair. The weight capacity of the Broda Elite Transfer Chair has a total weight capacity of 770 pounds. The Broda Chair Elite Transfer Chair as well is not to be used in the shower, as use in the shower may also cause the frame or components to rust. The Broda Chair Elite 785 Transfer System does have the same safety precautions and same safety when positioning a patient in the actual chair of your Broda Elite Transfer System. In order to operate your Broda 785 Elite Transfer System, you do have your levers located on the rear of your Broda chair to help tilt the seat, recline into a laying flat position or Trendelenburg position, as well as have a manual adjustment for your elevating leg rest or foot rest. The levers located on the rear of your Broda 785 Elite Transfer System are 3-position lever system. All the way forward in this position will mean that your wheel locks are completely stopped in a locked position. You do have separate total locks located on the front 2 casters of your Elite Transfer Chair system, which should also be locked when making any type of movement of the patient, whether it's transferring the patient into or out of your Broda Chair Elite Transfer System. So those are your 2 separate locks, as well as your complete lock on the stop lever located in the first position. The second position of your caster lever located at the rear will allow the casters to be able to move in either direction, so that you may completely turn the patient in a 360-degree circle if needed. So the second position will allow them to be turned in either direction for any patient or any maneuvering of your patient or resident while in the chair. The last position of your caster lever is the third position, which is used as a directional lock system for your casters. Moving your lever in this position will lock your rear casters into the rear direction as to assist with straight line movement down a hallway or aisle. Whenever making any type of positioning for the patient and adjustments to the chair, always make sure the patient's arms are within the chair's armrest and the seat are firmly placed onto the footrest here. The footrest does have the same adjustable length for your Broda Elite 785 chair as your 30 VT, which are 16 inches, 18 inches, 20 inches, and 22 inches in length. Once again, the proper seat adjustment or elevating leg adjustment for your patient while placing their feet onto the footrest, you should be able to fit one hand's width underneath the patient's thigh and the surface area of the Broda chair system or seating arrangement. The levers used to adjust your tilt or your recline are located on the rear. When making any type of adjustments, we said make sure your wheels are totally locked as to prevent any harm to the patient. Always tilt the seat first as to help prevent the patient from sliding or slumping forward when you activate your recline lever here to recline the patient. Now, your 30 VT only has approximately 45 degrees of recline adjustment range. Your Elite 785 transfer Broda chair will allow to recline all the way into a laying or Trendelenburg position. This position will help to assist with patient transfers in those situations when a patient can only be transferred from a bed to the chair or from a laying position into the chair position here. Whenever making any type of adjustments or attempting to transfer a patient into the chair, we said make sure all wheels are totally locked. Before we proceed, we will want to show you how to be able to remove your side rails as to assist with easier transfer in and out of the chair for your patient. Your side rail, which is a armrest, is swing away as well as removable. In order to remove or swing away your armrest, you first want to press down on the front end of the armrest. So as you press down here, then you want to depress your stopper button to release. Pull upward, then you may swing this to the side. Whether you swing it to the side or remove it completely for easier patient transfer. You will do the same from the left side or the right side, depending on which side the patient would be transferring into or out of the chair from. To place back your armrest, you would simply place the rear into the slot set first. Swing your armrest into position. Depress your stopper button and push down until it locks into place. So when preparing for a patient transfer into your Broda Chairs 785 Elite Transfer Chair System, first make sure all your wheels are totally locked. And then adjust your seat tilt as to help prevent the patient from slipping or sliding forward or off the chair. And then adjust your recline to recline all the way. Now, your wing here is removable as previously noted in the first section of your 30 VT. Simply press your stopper button located at the top side, remove the top side of the wing first, and then press the bottom stopper button and remove the bottom side of the wing second. So your wing, as well as your swing arm or armrest, are both removable to adjust and assist with easier transfer of your patients into or out of your Broda Chairs 785 Elite Transfer System. Once the patient has been transferred into the chair, simply replace your swing arm as previously shown and replace your wing. Bottom side first and then the top side. Your pillows are also adjustable with the straps, male and female quick disconnects. You can slide them up and down, the wings, for a perfect placement. Left or right side the same. And your head pillow also adjustable. Once the patient has been transferred into the chair, always check the angle of your tilt first, as to prevent the patient from sliding off of the chair or forward as you begin to recline the chair and move it into the upright position. The adjustments of your leg rest are the same as previously shown. You do have your spring-loaded bar here, which is set into place. Hold on to the frame of your leg rest. One hand on the right side, one hand on the left side. Squeeze the lever in order to compress the spring-loaded bar. Pull the one side, opposite side out, and then remove the other side. Once again, you will have different hole sets, 16, 18, 20, and 22-inch lengths. Once you choose the proper length and hole set adjustment, simply take your leg rest, of course, putting your spring-loaded bar section into place first. Compress your spring-loaded bar. Swing the opposite side into the proper hole set location, release the bar, and set them into place. Once again, your elevating leg rest is actuated when you recline or change the position of your recline, and if your leg rest position is uncomfortable for the patient when the chair is reclined, to manually adjust and change the position for patient comfort, you will need to use your lever located on the side beneath your swing arm. Simply squeeze your lever here. Once you squeeze the lever, then you can use your other hand to adjust for patient positioning. Once you choose the correct position, release the lever and it will lock into place. The Broda Chair 785 Elite Transfer Chair does also come with the adjustable armrest, such as the ones on your 30 VT. However, in order to adjust the height of your armrest of your transfer chair, no tools are needed. You do have the same range of 6 inches. However, to gain access, simply undo the Velcro which covers the panel to your squeeze levers. Simply squeeze both of your levers. Once you squeeze both, then you may pull on your armrest up or down and choose your proper hole set. Once you have your proper hole set, release your levers until they lock into position, and then re-Velcro the cover. Of course, when you change the position on one side, you want to make the same adjustment to the opposite side for your patient. This here is the Broda Model 48 pedal chair. Your Broda Model 48 pedal chair are for those patients that are capable of foot pedaling when maneuvering themselves in their Broda chair system. They do have a wheelchair-like wheel towards the rear of your Broda chair, as well as wheelchair locks levers located to lock the actual wheelchair wheel into a certain locked position. Located on the front of your Broda pedal chair, you do have your 5-inch total lock casters here. Of course, whenever making any type of maneuvering or placement of the patient into or out of the chair, it is always best to make sure that all total wheel locks are completely locked and that your wheelchair wheel locks are also locked, both left and right sides. You do have your wings, which are removable, as in your 30 VT model and your Broda 785 Elite Transfer Chair model. Simply press and remove the top side of the wing first, and then press the stopper button and remove the bottom side of the wing as such. They do come with the adjustable pillow for adjustable height of the patient with your adjustable quick disconnect snap locks on the back side of your straps. When replacing your Broda chair wing onto your pedal chair, always place the bottom one first. Once into position, then lock the top one into place. Your head pillow is also adjustable for patient comfort and patient height. If you look towards the front of your Broda pedal chair, you do have a seating height adjustment. The height adjustment range is from 12.5 inches all the way to 17.5 inches. When making any type of seat adjustments for the seat height, the chair must be unoccupied by any resident to prevent any safety or safety risk to the patient or resident, as well as when making the adjustment, make sure that both left and right sides of the seat are properly mounted in the same height adjustment hole set. In order to remove those bolts which secure the height seat adjustment in place, you will need to use your 7 and 32-inch wrenches. Located on the rear of your Broda pedal chair, you do have your anti-tippers, which will help to prevent your Broda pedal chair from tipping over if the patient's weight were to offset and lean backward in any given time. So your anti-tippers will help to prevent tipping of your Broda chair in the backwards position. There is no recline for your Broda pedal chair. The only adjustment that you will be able to make for your Broda pedal chair for those patients that can pedal or move with their feet is the tilt adjustment of the seat to help with sliding and sloping of the patient and falling forward out of the chair. The tilt lever is located at the rear of your Broda pedal chair, and to activate your seat tilt, simply squeeze your handle. While keeping your handle squeezed, you will press down on the frame in order to change your seat tilt position. Your seat tilt position, as we said, will help to assist with patients sliding or slumping forward out of the chair, and does have a range of 18 degrees. Your Broda pedal chair does come with your optional footrest with foot plates, which are stationary. They do mount to the brackets located on the side of your footrest Broda chair section. It does come with the optional footrest with a foot plate for your patient. The Broda chair model 48-inch pedal has a weight capacity of 660 pounds. And it does come in the various sizes, starting from 18-inch increments all the way up to 28-inch in size, in 2-inch increments. And that would be 18 inches, 20 inches, 22, 24, 26, and 28. The optional Broda tray can be used on your 30 VT, 785, or your Broda pedal chair 48, as well as your Broda pedal chair 48 should also be cleaned using the same steps as previously mentioned with your mild soap and water solution. Simply wipe it with a damp cloth, dry it with a dry cloth. Your armrests are also adjustable in height with a range of 6 inches. In order to adjust the height, you will need to unvelcro your side panel to gain access to your squeeze pins. Squeeze both pins to release, and then slide your armrest up and down. Once the proper height adjustment is obtained, release your levers to lock the armrest into place. And what you do to change one height armrest adjustment, you will use to change the opposite side adjustment as well. And it does have the range of 6 inches.